everyone, Dr. Dominique here. I specialize in internal medicine. Welcome to my channel. Thank you for tuning in. Today I'll be discussing diabetes. Do you have diabetes? Do you know? Is your body trying to warn you that you're heading in that direction? Are you having vague symptoms? You know you're not feeling quite right. You're not sure what's off, but you know something's not right and you're concerned that you may be heading in that direction? Then you're here for a reason. This video is for you. I'll be breaking down, simplifying it all for you. What is diabetes? What are some of the early signs and symptoms that may be vague, but early signs and symptoms of diabetes? How does diabetes affect your body? More so, how does it wreck your body? Diabetes is a silent killer and it is very efficient at what it does. And finally, how to start reversing the process if you're heading in that direction, or if you've already gotten to the point where you are diabetic. How can you start reversing it and getting back to feeling good like you used to? All right, guys, stay tuned. Let's get into it. Hello, everyone. Hi, I'm Dr. Dominique Smith. I am an internal medicine physician. I'm a hospitalist, actually. I work inside the hospital taking care of acute illnesses for patients. I am actually a nocturnist. I work nights only. I'm actually at work now. I have some downtime before seeing my next patient, so I wanted to stop in and just discuss one of the most common and most prevalent conditions that are affecting a lot of my patients, and globally the prevalence is increasing worldwide. And with just discussing these conditions with my patients, once they are so ill that they have to come to the hospital and be admitted for it, these patients are diagnosed with these medical conditions. And in talking with them, I notice that they have no idea, very limited information about their own medical condition. And with talking with them, I'm able to shed some light, and I'd like to be able to do that with you all as well. So today tonight, I'm going to be talking about diabetes. Diabetes, that's what I'm going to start out with because it's super prevalent in my community, in my culture. But like I said, globally and worldwide, it's increasing, okay? So let's talk about this. Diabetes, let's start out with the basics. Let's simplify it as much as we can so that everyone can grasp it, grasp what they need out of it in order to be able to take that information in and really apply it to their own selves, their own lives, their family lives, their loved ones, okay, that may be experiencing some of these symptoms. Okay, so what is diabetes? Diabetes is a disease, it's a condition, a medical condition that happens when the body does not produce enough insulin, which is a hormone. It either does not produce enough or it does not respond to the insulin being made by the body. Insulin, the hormone made by the pancreas, which is located here, is responsible for sensing sugar levels in the bloodstream and decreasing it to a normal level. Okay? So if the body is not producing enough insulin, it can't do that effectively. And if it's not responding to the insulin being made, it cannot do that effectively. So what happens? It increases your blood sugar level, the sugar level in your bloodstream. That's diabetes, excess sugar levels in your bloodstream, okay? Because insulin is not being produced, or the body isn't responding to it appropriately, okay? So, like I said, the pancreas is located in this area right here. And this is the pancreas also, it makes enzymes to break down foods that we eat, makes hormones, and we're concentrating on insulin today. Okay, so insulin targets the cells. Cells need sugar in order to have energy, right? And the cells have receptors on them where the insulin sits and it absorbs into the cell and it brings in the sugar levels that we eat. And once the sugar levels in our bloodstream go back down to normal after we eat a large meal, it spikes, insulin's made, it goes back down to the normal level. The cell sends a signal back to the pancreas saying, okay, I'm good. You know, the levels are low enough, back down to normal, and the pancreas shuts off. Okay, we eat another large meal of carbs. Carbs is sugar. And what happens? Our sugar levels start to spike. 10 to 15 minutes, it spikes. The insulin senses that, it gets stimulated. Sorry, the pancreas senses that, it gets stimulated, and it makes insulin. Okay, and again, the cell absorbs it, the sugar levels go in, and the sugar levels go down in our bloodstream. The cell sends a signal to the pancreas saying, okay, I'm good, and shuts off the pancreas shuts off. And again, it's a cycle. You eating, insulin's made by the pancreas, cells get stimulated, insulin goes in with the sugar level goes back down. So what happens when we're eating tons of carbs all day like this? The normal blood sugar level is 80 milligrams. That's 1 teaspoon in all of our blood, which is 4 to 5 pints, depending, on the person. 1 teaspoon of sugar, that's normal. Do we eat that? Does the average person eat that? No. The American Diabetes Association recommends that 45 to 65% of our diet be carbs. That equals to about 225 to about 325 milligrams daily. That's what they recommend, when the normal level is 1 teaspoon. 200 to 300 milligrams is about 31 teaspoons that we take in daily. So all that sugar's coming in all day, and our pancreas making insulin, sensing it. Why? Because too much sugar in the bloodstream is toxic to the cells, toxic to our arteries. It destroys the lining of the arteries. It oxidizes them. It causes plaques to form, calcification, leading to complications like heart disease, strokes, and so forth. We'll talk about that in another video. And so let's get back to this. So we're taking in all this sugar all day, carbs all day, pancreas continually to make insulin. Okay, so what happens with the cells? The cells protect itself. Why? Because sugar is not only toxic, too much sugar in the bloodstream, too much insulin levels in the bloodstream is also toxic to the body. Okay, so the cells are like bombarded with insulin all the time, all day, every day. So what does it do to protect itself? It builds up a resistance, okay? Just like if somebody's coming at you, they're interested in you. They come up and they're communicating with you and you're feeling them. Y'all are vibing. You're good with that. But then all of a sudden they just continue. They get even more obsessed. They're talking to you, all day, every day, calling you. What do? You block them. You're done. Okay, that's enough. I'm good. You resist them. You build up a resistance to them, to that attention, to that communication. And that's what happens with your body and your cells at a cellular level. Okay? So although you're eating tons of sugar's going in because you haven't changed your diet, sugar's coming in, your pancreas is responding to it, stimulated, making tons of insulin, but the cells are saying, I'm good. Okay, I'm good. I'll take some energy in, I'll take some sugar, but I'm not taking all of that. Okay, so insulin levels are going up. So insulin also, if it has all the sugar level, what is it going to do now? It starts to store the extra sugar. It hides it away, tries to get it out of the bloodstream. It starts to store it in your liver. It's storing it, in your muscles. It's storing it in your fat tissues or adipose tissue, your fat cells. Okay, leading to obesity. There's so many complications. So, the sugar levels are still coming in. In 10 to 15 years of the pancreas just making tons of insulin, trying to force it into the cells that are resisting it. After all this time, it's exhausted. 10 to 15 years down the line, it's like, hey, I'm done. No matter what I do, the sugar levels are out of control. I'm done. I'm tired. So it shuts off. Okay. And it stops producing insulin. okay? And then on top of it, your cells are resisting it. So it's not responding to the insulin that's in the bloodstream. So it says, forget it, I'm done. Stops making it. But what happens when we continue to eat, 200, 300 milligrams of sugar when we should be getting, 80 milligrams of sugar? What happens? Sugar levels are going up. Like I said, high sugar levels are also toxic to all the cells, okay? They work on the eyes, the small vessels. It's a silent killer. Small vessels in the eyes, you go blind, vision changes, okay? It works on your kidneys. How can you recognize before you're diagnosed with diabetes that, this is the process, that 10 to 15 year process? Is there no symptoms? There's symptoms. They may be vague, but you know your body. You know your body, and something's off. Something's off, but you're just not sure. You're feeling tired. That's one of the first symptoms. Very common, tired. You've been sleeping all night. You wake up in the morning, still tired. No energy all day. Wanting to nap all day at work, just tired. No energy. Don't want to do anything, just lethargic. Another symptom, frequent urination, just peeing all day, having to pee. At night, can't sleep, waking up multiple times, having to pee. Why is that? When the sugar levels are that high in the body, it's trying to store it in the liver and the muscles and fat tissue, and it's also working on your kidneys. Like I said, it's dumping it, trying to dump out the excess sugar in the bloodstream. So you're peeing it out as well, okay? So you're peeing all day. What happens? You're dry. Your mouth gets dry. You're thirsty. Drinking tons of water all day. Can't get enough water. Tired. Frequently urinating. Dehydrated. Like I said, the cells take in sugar for energy. It's fuel, okay? The brain cells, neurons, they use sugar as fuel. So if those cells are also resisting the insulin, resisting, the sugar going into it, what happens? They're starved. So you start to get a brain fog, memory problems, forgetfulness, just feeling just off, Anybody ever feel like that and not know why? That's the start of dementia. Those are early signs of dementia, okay? Dementia, very prevalent, right? It's increasing as well. Think this has something to do with that? Of course it does, okay? So these are some of the symptoms. What are some other ones? Very common ones. Numbness and tingling in your fingertips, in your toes. Why? Because it's destroying capillaries. Your nerves, you start to feel like pinpricks. Numbness and tingling, okay? Those are symptoms. It messes up circulation as well. Men, having problems keeping your stamina, having problems, getting an erection and keeping it, erectile dysfunction. Just don't have the stamina you used to, right? This is a sign. Okay, another sign, you're eating meals all day. You eat a large meal, hungry again, frequently having to snack throughout the day, and craving carbs. Why? Because the body is, although you're eating tons of sugar, even though you're, eating all day, your body is still starving. It's craving carbs because it's not going into the cells. It's staying in your bloodstream. Okay, it's not energizing you. It's just staying there. You eat large meals, eating multiple times a day, high carb diets, craving chips, craving donuts, craving sodas, pizza, bread, pasta, rice, these things, craving sweets. You're eating it, yet you're still hungry all day. Okay, these are some of the symptoms. Right? So you start to experience some of these symptoms. Now that you're listening to me, you're starting to think back. Yeah, man, I'm tired all day. Another symptom, you look down, you can't see your feet because your belly, like I said, it stores extra fat, insulin, storing it, trying to put it everywhere in adipose and fat cells. You get obese, especially in this area right here, truncal obesity. That's a symptom. So you're getting these symptoms, you're starting to realize, there's something wrong. And these symptoms are so vague sometimes that you ignore them and you start to get used to it and feel like this is normal. You need to think back to how you used to feel. That's where you want to go. So what do? You start to suspect that maybe my sugars are too high, something's off here. Anybody can find out. You don't have to go to the primary care physician. If the symptoms are super vague, you should, but if you don't, there's a way to do it at home. Anybody can go to Walmart, Walgreens, CVS, and buy a glucometer, okay? Go home, check your blood sugar level. Like I said, normal sugar level should be 80. 80 to 99 is the normal range, okay? You wanna check it when you're fasting. You wanna get a fasting blood glucose level, okay? So the best time to do that is first thing in the morning. You've eaten dinner, you go to bed, you need to fast for about 8 to 12 hours to get an accurate number. Okay, check it first thing in the morning when you wake up. If it's 80 to 99, you're good. That's normal. Okay. If it's 100 to 125, that's pre-diabetic. Okay. And if it's greater than 125, 126 or higher, that's diabetic. Okay. So at that point, you need to make an appointment with your primary care physician, and we can do a lab called a hemoglobin A1C. Now, this blood test tests how your blood sugar has been ranging for 3 months. Okay, so a normal hemoglobin A1C level is 5.7 or less. Okay, if it's 5.7 to 6.5, that's pre-diabetic. Your blood sugar levels have been ranging between 100 and 125 consistently for 3 months. That's what that's saying. And you're on your way to diabetes. That means you've been resisting insulin for about 10 to 15 years, okay? And you've made it to pre-diabetic phase. Now, if your hemoglobin A1C is 6.5 or greater, it can get much higher. You're diabetic, okay? Now, you are at home, let's say you're at home and you check your blood glucose level and it's high, it's 200, 300, 400, 500. What can you do? You don't have medication, you don't have an appointment, with your primary care physician to get any medications for this. What can you do immediately to bring that level down? Drink water. Drink water. You're already having these symptoms of dehydrated. You're probably already dehydrated and depleted. Drink water. When someone comes into the hospital, into the emergency department, and I admit them and their sugar levels are high, I give them fluids, IV fluids. Okay, brings it down. Bring it on down, flush it out. I also give them insulin, usually. These patients are usually diabetic, but some of them, are just like you all out there, not sure, having these symptoms, but the symptoms, they're not so vague anymore. You can't get out of bed. You can't perform at work. You can't, you're feeling awful. You're peeing all the time. You're dehydrated. You can't hold fluid. So you come to the emergency department, and you get diagnosed. Okay, but if you're having some of these symptoms and you get that glucometer and you check it at home and it's high like that, drink water. Call your primary care physician and make an appointment to get that hemoglobin A1C checked. And if it's high, there are medications that we prescribe for it. There are also holistic or natural fruits of the earth. I like to call them, God has put everything here to treat all these ailments that you can use, But if you're in the diabetic phase, there are medications that you can get started on that will bring that level down, because all that time that the sugar levels, 3 months or even more, that it's been high like that, it's destroying your vessels. It's destroying your arteries, your eyes, your kidneys, circulation, your heart. Okay, it's working on all of that all the time. You don't know it, you don't feel it. Diabetes and high blood pressure are the silent killers. You don't feel it until the damage is done. Okay, all right. So some of the medications you probably heard of: metformin, Actose. Some of them work on the cell to help the cell, receive the insulin. They've resisted it, but it helps it receive the insulin. Okay, some of them work on the pancreas and squeeze those cells, you know, that make insulin that have burnt out, and some of them work on your kidneys to help get rid of some of the glucose or sugar like that. If you notice you're having these symptoms and you want to do something about it, you want to reverse what you did over all these years. It didn't happen overnight. You want to go back and start slowly reversing some of the things you're doing, like you're eating tons of carbs. That's what's leading to it. You want to decrease your carb intake. All right, lower that. And then also you're eating frequently all day, snacking all day on carbs. You want to decrease the frequency of how often you're eating. Okay, and I'm sure that you've heard of intermittent fasting. That's something I'm going to talk about further, you know, how to start combating and reversing insulin resistance before it's gotten to prediabetes. And if you're pre-diabetic and diabetic, yes, you can start reversing that with lifestyle modifications. Okay, at that point of diabetes, if you made it there, you know, you may need to be started on metformin or one of the first line treatments until you can start changing your lifestyle. But you can do it. Okay, and I am going to make more videos on how to do it and explain the medications, talk about the side effects of them, how they work, you know, what organs they work on, and how to, you know, get around some of the side effects. All right, how to combat some of them. And I will talk about more of the complications of diabetes. You know, if you're experiencing some of those, how to treat them, how to reverse them. Can they be reversed? All right. So that's what I have for you today, and I thank you for tuning in. I really enjoyed this. I love being able to give it back like this, and I'm going to continue talking about not just diabetes and complications of it, but other disease processes. All right, guys, thank you for watching my video. If you found anything helpful, got anything out of it, please like and subscribe to my channel. If you have any questions about anything I discussed, or if you would like for me to discuss any other specific topics, then feel free to leave a comment down below. I will also leave my email, so if you don't feel comfortable leaving the comment or questions there in the comment section, then feel free to email me. I will respond and check all of them. And yeah, if you feel like you need more one-on-one help or information, then I'm considering opening up some slots in my schedule for one-on-one consultations. So if that's something you're interested in, and there's enough interest, then, you know, leave a comment and it'll motivate me to get that process started. Okay? Thanks again, and until next time. Remember, you have one life. Let's live it right. If you're not feeling well and you know something's off, you don't have to do this alone. I'm here, you know, there's a lot of help out here. Hit me up, let me know, and we can walk through this together. You're not alone. Okay? All right. Take care.